Hello all, I am Dr. Walter from SNS College of Physiotherapy. Today we are going to see Tabes Dorsalis. So it is a clinical neurological area. So we are going to see this neurological condition. What type of condition like is this? And the definition, the etiology and the pathophysiology, the clinical manifestations and all these things which you are going to see in this video. Hope this video will be helpful for the clinical practice. Now, what is Tabes dorsalis? It is a neurological disorder, chronic degeneration of the nerve fibers, which affects the spinal cord and also the nerve roots. So, it is a slow degeneration of the sensory neurons. It is a severe form of the neurosyphilis. So, this condition primarily it impacts the spinal cord's dorsal columns and it will affect the sensory and also the motor deficits. It is most important that this will affect the spinal cord, its sensory and the motor deficit and along with the nerve roots. Now going for the etiology, the causative bacterium is syphilis and the term is Treponema pallidum. This is an important virus, this is an important bacterium of the syphilis which affects the spinal cord. So untreated syphilis. So if a patient is occurring with the syphilis condition and they are not going for any treatment and they have not taken any type of medication, this will lead to the tabes dorsalis, nerve damage, direct bacterial action on the sensory nerves. Treponema pallidum will affect the nerve fibers at direct. So it will take a longer period of time to damage all these things. So it arises from the untreated or inadequately treated syphilis. The impact of the disease will be carried out and it will lead to many types of conditions. Going for the global impact, the epidemiological demographics. Here we can able to see how many patients have been affected on these areas. So it will be causing over on a highest range and this type of global impact will be helpful in statistical management. Going for the pathophysiology, the dorsal column degeneration, loss of large myelinated fibers, impact of proprioception and the touch, that is the sensory impact disruption, axonal loss, irreversible damage to the nerve axons. If a cell is going for irreversible damage, it cannot be reversed at any cost. The chronic inflammation will be going for the exacerbation of the condition. So it clearly states that it is a slow demyelination. It is not a rush. It will take its time, years, and it will demyelinate the nerve fibers in a slow process. Primarily, it affects the spinal cord and leads to the impairments of the function. Proprioception, sensory, and the vibratory are getting damaged here. Chronic inflammation also plays a greater role in this area. Clinical presentation for the sensory and motor manifestation. First, it affects these things, that is lancinating pains, paresthesias, ataxia. Sensory symptoms, common pain areas without having any type of conditions. And motor symptoms going for the muscle weakness, gait disturbance, and Rombox sign. And these types of things are in the first category, that is going for the sensory, sharp shooting pains, loss of coordination, unsteady areas, and muscle weakness. And the thing which we need to find out is the Rombox test. Next one is going for the autonomic and ocular signs, that is Argyll Robertson pupils, which react to the accommodation but not to light. So normally our eyelids will be accommodating to several things which we see: visceral crisis, abdominal pain, the vomiting and the laryngeal spasms. The abdominal pain is maybe considered as a normal thing, but based on severe case studies, we can able to find out what type of condition is this. So major thing which we need to understand is the Argyll Robertson pupils. Essential investigation is CSF analysis, cerebrospinal fluid analysis. Serological test will be going for VDRL test, FTA ABS test, that is a syphilis test, which we all know. MRI of the spine, which will show what type of infection and what type of conditions which is happening in the spinal area. And going for the modern management, antibiotic therapy, the symptomatic relief, that is pain management, and the physical therapy, rehabilitation, and the bladder management are the major modern management strategies. Key takeaways, that what is happening, that is prevention is the most important thing. As we all know, this is a slow process of attacking the spinal cord area. Prevention is most important. Comprehensive patient can multidisciplinary approach like physiotherapy and physicians and all these things will be most important. Research, so nowadays research for each and every conditions are going on, and for the Tabes dorsalis also, dorsalis new therapeutic strategies has been under the research methodology. Hope we'll find a good solution for the Tabes dorsalis. Hence, we can able to understand what is dorsalis and all these things which we have learned in this video. It will be useful for your theoretic and the examination purpose. Thank you.